Hi, my name is Meera Beharry, and I'm a pediatrician and adolescent medicine specialist, owner of adolescentmedicineconsulting.com, here with another video for you about adolescent health issues. This one made me inspired to wear the white coat. Yes, I am a physician, and because of an issue that recently came up for a patient, I felt the need to remind everyone about some resources that are available that my colleagues in emergency medicine may not be aware of. So this video is for my folks who work in emergency rooms and urgent cares, and hopefully it'll be helpful to y'all. So as you can see on the screen, we have a website from the Academy for Eating Disorders, aedweb.org, aedweb.org. And this website is from the Academy for Eating Disorders. And what we're going to do is just pop over to the resources section and go to publications, and you can see that there's tons of publications. So this is the site that we are on, AED Publications, and there's tons of information here, some of which has been translated into different languages. So one of the ones that I've used frequently when teaching other physicians is Eating Disorders, A Guide to Medical Care, and hopefully this works when we click over to it, that you will continue to see it. And as you can see, we're up to the 4th edition of this document, and it has been endorsed by several folks: the American Academy of Pediatrics, American Psychiatric Association, Canadian Pediatric Society, Colegio de Pediatras de Nueva León, and the Society for Adolescent Health and Medicine, as well as being translated into several languages. And this is a great resource for learning more about eating disorders, signs and symptoms, and things to look out for. In future videos, I will go into more detail about this resource, but the one that I wanted to share for my friends in the emergency room is, as you can see, as I scroll down, there are nutrition guides, psychological therapies, all this other good stuff. But ta-da, we have eating disorders in the emergency department. And in addition to the medical care guide, I recommend folks read this. We know that our emergency medicine colleagues are busy saving lives, so this is a short document, 3 pages and really 2 pages of content going through some of the signs and symptoms that people might complain with, and areas that you might want to do a little bit more of a nutritional assessment to find out if your patient has any signs or symptoms of an eating disorder. And the part that I want to highlight is that, of course, we want to stabilize any life-threatening medical complications, any electrolyte abnormalities, all of that. But one of the things that we want to do is avoid aggressive fluid resuscitation in stable patients without signs of decompensation. That is mental status changes, shock, all of those things. Because if we aggressively fluid resuscitate a patient, we can actually put them into congestive heart failure and cause more problems than we're solving. And you know, our first thing is do no harm. So I know no one intentionally wants to over resuscitate a patient with fluids and put a patient in a dangerous situation. So I'm hoping that folks will read this and think about this before they aggressively resuscitate or even give a fluid bolus to a patient who is able to take in fluids by mouth and is not having any severe electrolyte derangement. Even when they are having electrolyte derangements, we want to replace slow and steady and make sure that we're checking labs frequently. So this is just part of the information that I like to share with folks in my little company, adolescentmedicineconsulting.com. If you'd like a more detailed presentation for your emergency room or hospital, please give us a call or reach out to us via our website. Links will be below and in the information section of this post, and continue to stay tuned for more videos about adolescent health and all the different things that you can do to help the teens in your practice stay as healthy as possible. Thank you for watching. Take care. Bye.